It is my great pleasure today to host in this Ask the Author session Dr. Virginia Mela. She is an associate professor at the University of Malaga in the Department of Biomedicine. And she recently published with co-authors a fantastic paper in Gut. The title is Microbiota, Fasting-Related Changes Ameliorate Cognitive Decline in Obesity and Boost ex vivo microglial function through the gut-brain axis. So, first of all, thank you very much for agreeing to do this interview, Virginia. I congratulations for this paper to you and to your co-authors. So, in my daily practice, I discuss with patients with fatty liver how to eat, what to eat, and Mediterranean diet, keto diet, alternate fasting, all that is coming for discussion. And I always like welcome new arguments in the discussion. And here I think you're providing something extremely interesting. So first of all, can you tell us what is the design of your study?
Yeah, sure. Thanks so much for inviting me here. I really feel pleased to be here with you to talk a little bit about science. So this was a control randomized trial where 96 individuals living with obesity were allocated in three different experimental groups based on a hypocaloric diet. So they follow a specific hypocaloric diet for 3 months. And this diet were, the first one was the Mediterranean diet, based on olive oil, fish, legumes, vegetables, reducing the intake of red meat. The second diet was the ketogenic diet, based on a low carbs intake, so around 5% of low carb intake, 65% of fat intake, and 30% of protein intake. And the third one was the alternative fasting that is based on combining 1 day of regular eating but control. So that means that they are having the same restriction in terms of kilocalories than the other two. So around 600 kilocalories restriction, following by a second day of fasting where the individuals are allowed to eat only 25% of the daily needs. So the main aim, well, there are two different aims in this study. The first one was check which diet was the most beneficial in terms of losing weight. And the second aim was to check which one was better in terms of improving the cognitive performance of these individuals, since everyone knows that obesity is really linked with a cognitive decline. So based on that, what we did was collect feces and blood samples from these individuals before and after the 3 months diet. And also these individuals perform different tasks, cognitive tasks, just before and after the 3 month diet to check how their cognitive improvement were related with the different diet. And also we were interested to check microbiota changes are related with the different diets. So is there any specific diet that could change microbiota profiles of this individual in a beneficial way, let's say?
So, and with that, what did you find?
Well, first of all, the three diets where they got similar results in terms of losing weight. Even though the ketogenic diet was bigger in terms of fat mass decrease, it was surprisingly the alternative fasting. They want to improve the cognitive decline and, let's say, more success than the other two. So when we try to see what's going on with this diet specifically in terms of improving cognition in these individuals, first we check the inflammatory state of this individual after the 3 months diet. And what we found was that the different inflammatory markers, systemic markers that we analyzed were reduced by this diet. Second, we wanted to check the direct link between this anti-inflammatory effect of this diet with the brain function, so the cognitive function of these individuals. So we wanted to check in an in vitro experiment the functionality of microglial cells, since microglia are the main immune cells in our brain, are our sentinels. So what we found is after this 3 months diet, when we compare with basal condition of these individuals, this microglial diet looks, let's say, healthier because they improve their functionality. And after that, in order to check if also the alternative fasting has any beneficial effect in our microbiota, in the microbiota of these individuals, we found that the alternative fasting could increase some beneficial taxa, bacterial taxa, that were related with cognitive improvement. And going further, try to see if there are any specific metabolite, microbiota metabolite, that could be the main responsible of this beneficial of this diet. What we analyze the secretome of the microbiota of these individuals before and after the alternative fasting, and what we found was an increase in riboflavin that was already described to have anti-inflammatory effect and also immunomodulatory properties.
Yes, I mean, it's a really paper with many dimensions, and really like the link between metabolomes, metabolites from the gut having an effect on the microglial function. So now the landscape to treat fatty liver, or MASLD as we call it, is getting a little bit crowded with different drugs coming, phase 3, some already on the market. So what do you see the place of your approach in this landscape? How do you see the clinical impact of this work?
So, well, considering that disease it's driven by metabolic dysfunction and also has like an inflammatory impact in the individuals, it makes sense that using this kind of approach, dietary approach, that could has benefits for both events, so metabolic dysfunction and also inflammation. This could be this will have a great impact in the development of this disease. From my point of view, I truly think that could be more than preventive, like a preventive strategy rather than a therapeutical strategy, because if you are in the latest stage of the disease, maybe you cannot have this kind of benefits from the diet. However, if you introduce this kind of pattern, dietary pattern, into your lifestyle, could decrease or lowering the risk of developing this disease, the liver fatty disease, but also other comorbidities related to obesity, and help and support the early care of this individual living with this disease, and maybe complement future therapies for this for fighting this disease.
Great answer. Thank you very much. Thank you very much for being with us today.
Thank you for having me here.